Emily and Jack, parents to a 3-year-old son, had no trouble conceiving their first child. However, after a year of trying for their second baby, they faced unexpected difficulties. Despite their previous success, they were now grappling with emotional and physical challenges of secondary infertility. That is, not getting pregnant after having previous children. That is, secondary infertility is the inability to conceive or carry a pregnancy to term after a previously giving birth to one or more children without the use of fertility treatment. So this condition can be both physically and emotional challenging for couples who previously experienced a successful pregnancy. It's emotionally draining. Secondary infertility is more draining, and studies suggest that it accounts up to 50% of infertility cases. Couple, Couples experiencing secondary infertility often feel overlooked as much as public focus more on primary infertility. People tend to focus more on people that has not given birth before than people that has given birth. Causes of secondary infertility. The first one is women's age. A significant factor in the age of a woman, fertility naturally declines in age above 35. It can affect the woman's quality of egg and making it harder for the woman to conceive. As a woman age, their fertility function declines. Likewise, men's age. Although men can remain fertile much longer than women, the quality of sperm can decline with age, potentially affecting their fertility. You get because men, as they go down in age, the quality of their sperm tends to decline, but they remain fertile for much longer than most women unless they have underlying health issue. Ovulation disorders. Conditions like PCOS, thyroid disorders, and premature ovarian insufficiency can disrupt ovulation and leading to difficulty in conceiving. So if you have any of these conditions I mentioned that hinders ovulation, this can be the cause of a secondary infertility when a woman doesn't have these things in her first pregnancy. Scarring and blockage. That is, conditions such as endometriosis and pelvic inflammatory disease or previous surgery, maybe cesarean section, can cause scar to your fallopian tubes and uterus, preventing fertilization and implantation. The person will be like, I've given birth before. Why is it difficult for me to get pregnant? Maybe your previous cesarean section or you developed endometriosis. The next one is uterine fibroid. Is a non-cancer growth on the uterus that can interfere with implantation and ability to carry a pregnancy to term. So maybe in your first pregnancy, you don't have fibroid. Maybe later, before you start trying for your second baby, you have developed fibroid due to many factors, maybe from the contraceptive pill you are taking and the rest. Male factor infertility is the next one. Issues with sperm production like motility, morphology, and can develop and worsen after a previous successful pregnancy. Maybe lifestyle factors, infection, and medical condition can contribute to that, and even varicocele. Maybe you develop varicocele after your first pregnancy. The next one is weight changes. Significant weight changes or loss in either of the partner can impact fertility. Obesity, in particular, in association with lower likelihood of conception. Maybe after your first baby, you added a lot of weight. This can hinder your chances of conceiving earlier in life when you want to. Smoking, excessive alcohol consumption, drug use, and stress can negatively affect your fertility both in men and in women. Maybe you are stressing yourself out, you consume a lot of alcohol over time, this can affect you. Maybe it didn't affect you in your previous pregnancy, but as time goes on, it might affect your chances of fertility. The next one is chronic conditions like diabetes, autoimmune disease, or new issue that arise after first pregnancy can impact fertility. Maybe during that first pregnancy, you have gestational diabetes and it continues and you are now on medication. This can hinder fertility at some times, you get. So maybe you developed a disease after your first baby, it can also interfere with fertility. Medications, taking new or existing medication, the side effects you get, maybe you are on antihypertensive, some kinds of antihypertensive after your first pregnancy, there is chances that it might affect you during your second baby or when trying to have a second or third baby. The next one is sexually transmitted infection like chlamydia, gonorrhea, leading to scarring, blockages in your reproductive organ, affecting fertility. Maybe you don't have all these things before. Maybe your partner got it, transferred it to you, or you got it somewhere, something like that. This can affect your fertility. Or this disease had been minor, you didn't treat it well, it can also increase. Another one we are discussing is diagnosis. How would you know you have secondary infertility after conceiving the next first one? You can go for ultrasound, you can go for blood tests to check your hormones, that is FSH and the rest of them. You can do sperm analysis, always do ovulation prediction, like use your ovulation predictor kit and consult with your doctor. The next thing I'm talking about is treatment. You treat it by maintaining a healthy lifestyle. In severe cases, if treatment is cannot help, IVF can solve it. In some cases, doctors might prescribe medications to induce ovulation, like Clomid. You might go undergo surgery to remove scar tissues and endometriosis and fibroids. So, another one is consultation with your doctor. If this video has added value to you, don't forget to subscribe to this page for more health content like this. See you in my next video. Bye.